Hey everyone, it's Eric from founderspeedo.com and I'm so delighted to have Jay from Able Innovations. Jay, thanks so much for joining.
Thanks a lot for having me. Appreciate it.
Okay, so before we dive into the questions, a big shout out to our sponsor, Headway.io, helps founders validate and build new ventures. So check out Headway.io, our sponsor, and we're ready to dive into the questions. We have Jay. So Jay, can you tell us a little bit about yourself and your venture?
Yeah, absolutely. So I'm an engineer by training. I graduated from the University of Toronto, but over the last 10 years, I've had a pretty long path towards developing some really cool technologies. So I started off my career in the solar industry. I was developing dual axis solar trackers. So you put panels on them and they follow the sun. For 8 years, that journey took me to China every year. For 6 years, I spent 6 months there. Then I went on to the business side. I launched another venture in product development called Invest in 2016. And then along with my co-founder, same with Invest, we started Able Innovations in 2018. But something about me personally is I've always had an affinity towards long-term care. My mom worked in long-term care, so I had a lot of exposure to get into this completely different world where I made friends with individuals in residential care. And I realized we're all going to be there. So that's where the key motivation behind Able Innovations came about, is how do you make aging more dignified? And how do I help that segment of the population that seems to have been forgotten by many of us?
Right. So tell me about Able Innovations. Like, how did you, of course you had exposure, but what was the inspiration behind the idea? What was it like in the early days? Did you just wake up one day, you're like, okay, I got to build this, or how was it?
Yeah, it was, honestly, it was very, very different and scary. There's multiple aspects to it. First is, I'd been in the robotic space in energy for a good part of 8 years, hardware development, but healthcare is a different beast. So one was entering that. But the key thing was, ever since, I moved to Canada pretty young, I was 15, but I started working in long-term care volunteering. And I always wanted to see what I can do to keep people at home longer, because that was the one thing whenever I spoke to residents there, they said, I wish we could be at home with our families. And when I started asking, why can't you be at home? They said, well, I had a hip fracture. I need to be taken care of because I can't get out of bed. So I even volunteered for charities delivering food at home, because sometimes people couldn't cook. That's why they had to change. But this was a cause I'd really associated with for a really long time. And it was on a personal thing. But I'd say in 2015 and then around, it clicked on me that, you know what, I can use robotics to solve this problem of keeping people at home, because one of the biggest reasons people leave their homes is they can't get in and out of bed, or the spouse can't get them in and out of bed. Once you can imagine you're both aging, it becomes difficult.
Right.
So that's where the motivation behind Able came about. And I started the venture, actually, interestingly enough, a couple of months after I got married. And I got my first mortgage. And that's when it was a gut check moment, because everything was going towards stability and wanting more stability. But I really wanted to do this one thing. So it took me 3 years of thinking before I quit my day job and founded Able Innovations, convinced my wife that, you know what, right now is the only time in my life I can do this. After this, we'll have a family. Now I do have a child. So but back then, I could take on this risk and start. So it was kind of scary, changing sectors completely. But still within the hardware robotic space. And I think me being an outsider has helped me a lot, actually, in the long run here.
Right. So talk about like the challenges. What were some of the early challenges you faced, like, especially for like prototyping or any other challenges that you overcame? I'm sure there's a lot, right? But what would be like, one or two challenges that would like really, kind of stood out?
I think there's personal and technical challenges. From a personal standpoint, it was, having a family start while growing a business is extremely, extremely challenging. You need to give your business your all, but you also need to give your family your all. So that was an interesting way to manage time, and I think it's shaped me. Also starting in a completely different industry for me. I did not have much experience in medical device. I had a lot of experience in devices and highly complex devices, but medical devices was different. There's different regulatory paths. So there's a lot of learning there. I think the other thing was the first year operating without any capital and learning what the financing journey. How do you finance a company? Because
Mhm.
hardware is extremely expensive. And that's
Right.
why a lot of times individuals and investors, they realize that there's a lot more risk, a lot more cost involved with hardware. But
Mhm.
one thing I had going in my advantage is I've been doing this for 8 years. So when it comes to
Right.
hardware, I'd made every mistake in the book already. So
Mm.
that was one good thing that came from these challenges.
Right. Right. So you had that experience, of course,
Yeah,
previously as well, right? Like
yeah.
going to China and like kind of doing all that. That helps, right?
Yeah, big time. And like a way I put it is my first venture, Morgan Solar, I'm extremely grateful for the learning they provided. But
Mhm.
I feel like they paid millions of dollars for my training in a way
Right.
because every hardware company makes mistakes.
Right.
Uh,
Right.
from me, it took, it was an 8 year journey to go from a design. I was the first one to start the design, and then I was on the field looking at these things going in massive fields. And it took
Mhm.
8 years, but I understood how much effort it takes. And not only did I do that for Morgan Solar, I did that for other companies as a part of my other business, which was Invest, where I started
Mhm.
helping other hardware scale ups do that. So I'd helped launch about 8 or 9 products by that time. So that helped
Wow.
me de-risk
Right.
that. Yeah.
Right. That's incredible. So talking about like you mentioned finances, right? Like
Mm.
any tips you have for founders that are building hardware startups that would help them to kind of survive
Mhm.
long term?
I mean, by no means do I serve as a model, but one thing I
Right.
learned early on is, the whole accelerator, incubator
Hmm.
ecosystem, everything is focused on pitching to investors. And
Right.
you're almost taught that you need investors, otherwise you're not a venture. Well, you need a product. You don't need investors. Investors are a mean.
Right.
And that's something I learned. And investors aren't for everybody. So what I did, I knew right away
Hmm.
I would, if I had to get investment, I would be selling a whole chunk of my company early on. And by
Right.
doing that, I'll be kind of sealing its fate to not being able to scale up. So what
Right.
I did was I really went after government sources. In Canada, we're so lucky to
Hmm.
have non-dilutive sources.
Right.
And the first uh, significant party that came in to help us was NRC IRAPs, the federal government. They
Right.
believed what we were doing. We managed our relationship with them.
Hmm.
And that's been kind of our biggest funder to date, even though now we have investors. That helped us
Right.
grow to the stage where we could have investors. So that's the one tip I'd say is navigate non-dilutive funding
Hmm.
very, very carefully before you get into the investor side and don't give up your leverage early on.
Right, right. Yeah, because what I love is you mentioned having a product and not just focusing on investors, right? Because I
Yeah.
mean, there's lots of ways to build companies, right? Like
Yeah.
you can fully bootstrap it, but I think
Mhm.
for hardware, like you mentioned, yeah, you do need some capital for sure to put in, and
Exactly.
yeah, you got to take advantage of the ecosystem or at least what's out there. Especially, I love non-diluted, right?
Mhm.
I mean, every founder should love it, right? Because
Yeah.
you're still in charge, right?
I mean, look at the shred, the math. Like you get 65% of it back. So
Right, right.
that's such a huge leverage that a lot of times people don't use.
Hmm.
I know founders that have had hardware startups for 3 years and not filed for shred. And it's just
Right.
because it seems like a bit of a black box. It's complicated,
Hmm.
but you have to be able to do that if you need to, build a big company sometimes.
Right, right. Great. So moving on to the next question, talk about like, prototyping. You're the
Yeah.
first version of the product. Tell me
Yeah.
how did you go about bringing that and what was it like?
Yeah, it was interesting. I remember because it was still just me for the first 8 months. I decided I'm an engineer.
Hmm.
uh, every bit of me says start making the product prototype, but I said the biggest mistake I can make is if I don't understand the market. So I spent the first eight
Right,
months meeting people and not touching the product. But then we got into a competition called Northumberland N100 competition out in
right,
Northumberland,
right,
and all of a sudden I was punching way above my weight because some of the companies in the last floor had been around for years, had prototypes. So they said, "Can you show us a prototype of your idea?" So within it was about 4 weeks to come up with a proof of concept of something small that showed how I
right,
can automate patient transfer. So literally, I had this small benchtop prototype, not bigger than this, that had a extending platform and had a stuffed toy filled with nuts and bolts showing the body. And I
right.
was developing this, transferring them here and there. And at that point, I was operating out of a space called Y Space,
Hmm.
operated by York. So I was there until 1 to 3 a.m. every night,
Wow.
figuring it out. So that's how the first prototype actually came about. But if you look at it now, there and where we are. It's actually a pretty cool story looking at the different prototypes and how we've grown there.
Right, right. And how did like your product evolve over time? Like, did you, did you add any new things
Oh
or,
yeah.
yeah,
Yeah, it's always evolving. And we're not developing something small. Like that's the hard thing. Like we're
right.
developing something that has, it's nearing automotive level in terms of how much complexity we have in our product.
Wow.
It's a big device, the size of a stretcher, and it's robotic. It's
Hmm.
not cheap to make. So the best thing we could do was develop prototypes that tell the story,
Right,
and then
right,
get user feedback. So the first
right, right.
prototype was benchtop. We got some interest. So what we said was we went to St. Michael's Hospital and said, you know what, this is our vision. We want to talk to hospital clinicians to
Hmm.
see if we can do something like this at a bigger scale in a hospital. And then we want to get into people's homes. So we started building bigger and bigger prototypes. At the end of 2020, we built like a pediatric size prototype, so half the
Right,
size of a normal person.
right.
And we were transferring essentially child-sized mannequins, and there's studies done on that were published. Then that got even more interest from the hospital out in Ottawa called Elizabeth Briere. Now they're piloting our technology. And
Hmm.
as we get more feedback from the industry saying we want it, then we put more money into it and do it, and we get
Right.
investors behind it. But if you did it blindly, it's like taking a shot in the dark, and you may miss very well.
Right, right. Yeah, because I think it's very tempting to just go build, right?
Yeah,
Because of course we're so attached to the idea, right?
yeah,
That
exactly.
why not just go build? But like you said, the problem is, you ended up, you can potentially end up building something that nobody wants to use, right? So
Mhm.
knowing the market. So speaking of like getting to know the users and the
Yeah.
market, what really helped you? Like, did you like go to the hospitals early on and email them, be like, hey, we're developing this. Is this something like you would use, or how did you go about finding those early adopters?
Yeah, that was the best because what I'm doing is something so personal, right? Just
Right,
for
right,
context, like at Able Innovations, we're developing automated transfer technology. So our technology can get people from a lying down position to a lying down position in an automated way. It's very dignified for people. In the future, we'll be moving people between beds to wheelchairs. So whenever you
right.
tell people this and families this, their eyes light up because
Mm-hmm.
people actually hate seeing their loved ones being transferred because right now you literally have to hang them on a crane and move them, and it's like you're being treated like a sack of potatoes. So whenever I tell families, hey, what if I could do this, their eyes would light up. They said
Mm-hmm.
you would be changing lives. So that was the most exciting and inspiring part. Then I talked to nurses about this because they're the ones doing this backbreaking work too.
Right, right, right.
And they said, you know what? I've had so many injuries. I know so many people who've ended their career moving patients. If you can do this, this would be absolutely amazing. And now you hear about worker burnout, and now it's a really important thing. But
Right.
in healthcare, it's multidimensional because the user, which is the frontline staff,
Mm-hmm.
the person it's being used on, which is the patient, and the payer is very different. So the biggest challenge I had was to craft it so that it fit the criteria of all three. So for the hospitals, why they would buy our technology, uh, that's something that's a slightly different thing. They obviously care a lot about the injuries to their staff, but they
Right,
also care about the economic case behind it, which is how much return on investment can I get? Can I
right.
get more patients on a daily basis because now I bought your technology? So those are the different areas and pitches I pitched to them as well.
Wow, right on. So not just like, helping their staff, but also having the ROI. I think that's almost with
Yeah,
almost every product, right?
you need an ROI. Yes, absolutely.
Right, right. So that's great. So yeah, so I always ask the guests on Founders Beta, what's the best advice you have for our audience? Whether it's building a company, whether it's startups, anything goes.
Yeah, absolutely. I think the best advice I can have here is that's a really hard question. I'll tell you that because there's no like best advice. There's a lot of things,
Right,
but
right.
don't get too attached to the product. I
Mm,
think that's the most important thing. We
right,
can, especially if you're a technical founder,
right,
we
right.
have this impression that if we build the best, most polished product, it'll sell itself. The thing is, if you build it in isolation and nobody knows about this beautiful thing you've built, no, it's not going to go out and grow.
Right,
So
right.
you have to always engage and do the thing that makes you the most uncomfortable.
Mhm.
Uh, because the reason we gravitate towards developing products is because that's what we know best. but talking to people who say no to you and convincing them to say yes is the best thing you can do. If you don't listen to your doubters and you surround yourself with people that say it's a great idea and you build your echo chamber, you can also go down the wrong path. So you always need to look at the opposition and understand how you can address their concerns in a good way.
Right. So for our audience that want to learn more, how can they get in touch with you?
Yeah, absolutely. So I'm pretty accessible. My email is j@ableinnovations.ca. You should visit our website, ableinnovations.ca, and there's some really cool content and really good news that's going to be coming up about our venture over the next 3 to 4 months.
Right.
And yeah, it's a very exciting time to be doing what we're doing. There's also LinkedIn, there's Twitter, so you can find all the links at the bottom of our website. But I'd encourage anybody who cares about what we're doing to reach out to us.
Awesome. Well, Jay, thank you so much for coming out and sharing your story with us. And we're looking forward to the development with your venture. So
thank you very much, Eric. I really appreciate it.